Hello, I am Shannon Pace-Brinker, and I am very excited tonight to bring to you a presentation that I have been working on for several months now, really to help understand a lot more about the aspects of disruption when it comes to biofilm. I can tell you that it's really important to think about the way that we are treating our patients now more than ever, because we're so aware of the dentition when it comes to erosion and when we think about malocclusion, chips, cracks, craze lines, abrasion. It's really important, and I really am so excited about the fact that over the last couple of years, it seems to be even now more than ever, that we're really looking at this dentition in a very different mindset. And so I think it's really important to just kind of go through tonight a few things with you, and really some nuances is what we know, not really as new to dental hygienists, but what we're finding in the dental assistant world is that more and more practices are utilizing hygiene assistants. And this really program came about because we were teaching several new hygiene assistants in our practice and having them to understand really those aspects of disrupting biofilm. And we utilize our assistants for coronial polishing. And a lot of them really did not understand why we were doing selective polishing. So we kind of had to back up a little bit to educate them, but most importantly, give them the knowledge to educate patients. And again, we're seeing more and more of this type of polishing in practices, and I'm really excited about it for the fact that I'm such a big advocate for tooth structure. And so tonight, I want to first acknowledge the fact that I do have an educational grant from DMG, and I can tell you that I'm very excited to go through several different ways of really taking care of our patients really in the hygiene chair, but also utilizing some of these areas as for those dental assistants that are out there tonight that may be interested in learning more about this as well. So let's get on with what we're going to be talking about tonight. Again, I mentioned the educational grant. I'm Shannon Pace-Brinker. I am a dental assistant, but I do teach a lot of courses, and really excited tonight because of the fact that I've written a lot of articles on the disruption of biofilm. I do a lot of evaluations for prophy angles and prophy paste, and I really want to take you through just several different ideas when it comes to looking at patients very differently and really disrupting that biofilm. The first part that I want to just kind of mention is that we're knowing now that the overall oral health has so much to do with every aspect of the way that we're treating our patients. We're now treating a body as a whole, and there are so many different areas of the United States and Canada where we're really doing this total body wellness. And I think that to me is very exciting for the fact that we're not just looking at teeth anymore. We're really trying to help patients live longer, healthier lives. And so as we go through a couple of areas tonight, we want to just remind ourselves of that, and just want to touch on some things that are probably going to be a little elementary, but it's really important to, I think, paint the story of why we're really looking at this disruption in rubber cup polishing. We know that proper oral hygiene is really important, and we feel sometimes that we are just really, I think, hard on, really tough on patients, but you can't feel that way. I hear a lot from hygienists who say, Shannon, I hate being the bearer of bad news sometimes, and a lot of times this is one of the things that we feel like we're doing, but it's not the fact that you're bearing bad news. You have to constantly educate and talk to patients, because it's amazing to me, even in this day and age, what patients don't know. I can tell you that even my mother-in-law, for instance, just a few weeks ago said to me she didn't understand why our hygienist, Melissa, didn't polish all of her teeth, that she only polished a few areas. And even though I know Melissa went over that with her, sometimes we think patients hear us and they don't. But I explained to her that it wasn't that Melissa was trying to cut corners. She was really thinking about tooth structure. And so when we think about proper oral hygiene can prevent tooth loss, periodontal disease, and tooth decay, we know that. And so when we think about all these areas that we can really help patients. And I really want to encourage you to think about this, because I'm utilizing now more videos, more PDFs on my desktop, so patients can relate and understand. Really reducing the sugar intake with the now we even look at the pH. We're looking at more and more patients and their habits. We have conversations not just in the hygiene chair, but even in our restorative chair as to, what are patients, tell me a little bit about your diet, tell me a little bit about what you drink, and, give me some feedback on that. And it's been amazing to me to open eyes to patients with patients who really feel they're being very healthy. But when I show them charts that show, water with lemon, and all the studies that we see now with Gatorade and vitamin water. And it's been a really eye-opener to look at, what patients are really, we call it self-inflicting their dentistry and their teeth with the things that they're eating and drinking. We have to all be on the same page, the whole team. We have to be able to have these conversations with reducing sugar intake and brushing twice a day. And I was reading up on the millennials, basically, and I know we hate to hear that word millennials, but it's true. Even the millennials now, they're saying they only brush once a day. They don't brush and floss. And again, getting back to that once a day, and hardly any right now, the percentages is less than, I think, 14% of the population are using a mouthwash. So we have to constantly perfect our craft and to really think about what it is that we're saying to patients, because the most important thing in dentistry, and we're in dentistry for the right reasons, every one of us, and we're in it because we care about those patients. And I feel like this is where we really have to have conversations, and then showing, again, the videos, having something that they can relate to. I think that we're seeing, the great thing is that we're seeing a decrease in cavities and caries compared to, several years present, but we know that we still have to talk about caries with patients. But most importantly, one of the other areas is looking at their medical history. And probably for the last year and a half, we've really been focused on this with some of the educational components that we've been building, is really looking at, of course, dry mouth and looking at medications that may be the reasons why patients have these chips and wear. Because we know that when we're looking at medical history and we're looking at why is this patient, every time they come in, they have a new cavity or they have cavities, which is my mother-in-law. She's on several different medications. And we know some of those medications we can't even pronounce. We don't know the name of it. A lot of times patients will bring it in a bag and you're like, oh my goodness, look at all these meds. Because we just don't really know what they are. And a lot of times we don't even know how to pronounce them, right? What are they doing to the body? And what are they for? Most importantly, what are they for? There's so many medications. But one of the things that we have really been focused on is some of those medications and what is it doing to the body? Is it something that could be the reason, especially these SSRI medications and, for osteoporosis? She takes a sleep medication. We know that a lot of the Lunesta, the Ambien, those types of medications cause dry mouth. There's a lot of things that we need to be more aware of now more than ever. And so I really want to encourage you to think about the medications and to really, educate your team to looking into those, because we know once the caries is there, it's not reversible. So it's something that we really want to look at. We also want to make sure that our patients are really understanding what is biofilm and how did it get there. So I feel like that's something that we want to help you with tonight, but most importantly, be able to leave behind and give you some of those photos, have some of those PDFs, some of these little videos that we can give you to help with that education and to help the patient understand what's happening. Because even though we take photos, and a lot of times we'll give them a mirror or we can show them by scaling it off, it's really a lot easier, and sometimes it registers more when we can show them videos of things that are happening in their own mouth. And so when we look at these locations and where is the carie starting, we know that there are 4 areas, whether it's linear enamel, we've got it on the occlusal surface, the smooth surface, and the hardest ones that we feel, and even thinking about our aging patients, are the apical areas. And so we want to kind of help them to understand that. Our patients deal with biofilm throughout their lives. And as dental professionals, we can help them better manage it really by rubber cup polishing in cases where we know that it's appropriate. And I think that, that education also allows us to ensure patients that we know that, that rubber cup polishing can control the biofilm, help prevent disease. But what steps can they also understand at home? And so really looking at, I think, something that we can really help to have them understand is that regular, brushing and flossing. And again, I'm speaking to the choir here, but having them to understand those areas and really thinking about how can we help them do better. The one thing that we don't know enough about, I feel, and just really and truly talking more and more, because it is just something that we have to be aware of. And even, I can't tell you how many even clinicians have gingivitis, and a lot of us may be chuckling, but I can tell you, we know a lot of people in our own profession, right, that have gingivitis and do nothing about it. And we have to really walk that walk and think about, when we're having these conversations of maintaining oral hygiene, cleaning the teeth, thinking about the habits that they may have. We want to make sure that we have a lifetime of proper hygiene, because we know that that's going to improve their quality of life. Getting back to the same areas that we talked about. It's also something for us to think about when we think about, fluoride and offering more fluoride, thinking about what are we doing in our practice, and have we exhausted all the areas to help those patients, and again, thinking of what can we do? Do we have systems? Do we have every area covered? I was given a course with one of my team members just a few weeks ago, and we were talking really about coding and insurance. And one of the questions came up, in regards to fluoride, and so many patients basically saying or not wanting to have the fluoride treatment. And I can tell you that it is something that my doctor just did not want patients to say no to, and to not give them that option, because they didn't want to pay the extra, $14, $11, and some practices it's even less than that. And we know that the most important thing, and my doctor said, the most important thing for me is to make sure that our patients are healthy. And if that means that, maybe raising the fee for the cleaning, so this way we can incorporate that to have better home care, but also better, just better care all around for our patients. That's what we did. And so, fluoride plays a very big role in that, and so we're going to talk just a little bit about that. And helping to aid those patients, because again, getting back to that full body connection, it's really important for us to understand that, bacteria that causes periodontal disease can spread throughout, the people that we love. We can pass it, and it's been proven. So we want to make sure of that. When we think about fluoride, it plays such an important role for prevention. And I can tell you that in our practice, we see a lot of different age groups of patients. And so fluoride really, again, is important, but we like to offer various types of fluoride still to this day. A lot of people don't want to offer anything other than fluoride varnish, but I can tell you that there are still avenues and great reasonings for why we are still utilizing fluoride foam and gel in our practices. And again, I know that it's a lot more work and it kind of can be messy, but I can tell you that that's one of the things that we wanted to just kind of talk a little bit about tonight. There's a great reasoning why the fact that we're using fluoride in our practice, because we know that it's been proven really to clinically provide at least 25% caries prevention. That's a very high percentage, and we're seeing this really grow, especially with caries prevention for high-risk children. And again, getting back to that, not having a reason for parents to say no to fluoride. Now, again, if they really and truly are against it, we will not do it, but we just didn't want that. And in our practice, we utilize this particular product because really, honestly, patients love it. And I can tell you that it really is recommended for all ages, which is fantastic. But most importantly, it has one of the best flavors ever. When it first came out, the Clear Shield, we were basically doing an evaluation, and I had only a few samples of this in my operatory. And a few weeks later, I had a patient actually, because we were headsets in our office, that I told one of my hygienists, said, I really don't want that. I want the caramel. And so she kind of pushed the button over the headset and said, has anybody seen or used a caramel varnish? Because our patient is asking and requesting that. And she said, we don't have caramel. And so I kind of said, yes, we do. We were evaluating it. I have some in my op. And it's amazing once you use it. Patients don't want anything else. It absolutely tastes fantastic. But what I love about this particular varnish that really is amazing is the fact that it is clear. And a lot of patients really will, reject having a fluoride varnish because they don't like the way that it feels on their teeth. But most importantly, they don't like the way that it looks. And so it's something really for us to really think about. This particular one is gluten-free. There is no soy. We're seeing a lot more patients now that have allergies to nuts and soy. And so this one does not have that. And it does contain xylitol, and I think that's a great plus as well. And so when we think about fluoride, that's one of the ones that we carry in our office. I will tell you that we also utilize a lot of foam, and we use this even to this day for children. And one of the studies that states that, just all ages of patients can benefit from 4 minutes of application of fluoride foam. And so it's something that, we want to offer. I will tell you that for patients that are going through chemo, we have them come in and we actually will utilize the foam. It just seems to be a better response as far as those patients go, because they're really, it's hard for them to swallow. I think they feel like it just kind of soothes everything. So we have more and more patients that really would prefer the foam, or going back to the foam versus the fluoride varnish itself. So we still offer that, and we want to have all different types of options for them. One other area that I feel like is really great is having a system. When we think about a varnish, having a foam, but most importantly, also having a gel. We still carry that. And again, being able to recommend this for all different types and having that. A lot of practices just have one type. And in our office, we want to have something for everyone, but we also want patients to feel like they do have a choice. I will tell you that the two that really most patients like is the foam, but also the varnish. But some patients really like the gel. It just depends. But this is a great line. If you haven't tried it, I will tell you that basically when it was designed, they had went to chefs who helped to create this line. And the flavor itself is really worth really checking into, because of having, the gourmet chefs really, or food experts, help design it. Really has made it one of the fastest hygiene products, I think, out there. I also love the fact that it's buy one, get one free. They always have great promotions. So I want to mention that, even though that's not part of the learn, but I feel like, sometimes we don't know that, and just want to make sure that you do. If you're looking into, purchasing something or looking at a new flavor, it's worth checking out. Let's talk about fluorosis, because we know that, this is one of the reasons why we have a lot of parents that will basically say no to fluoride. I want you to know that, it is caused, and this is something that, again, even team members, especially our office trained assistants, don't really know a lot about this. And as hygienists and assistants who are and have gone to school, that are certified, it's really important for us to always feel like we need to educate our team. And I feel like this is something that we need to do more of, because for us to be able to all be on the same page, having the same dialogue to patients, we really have to help our team make sure that they're, educated. And so I want to make sure that you understand, what is fluorosis. When we see these white spot lesions, a lot of times what most team members believe is they could have had ortho, and yes, where a little bit of that plaque sits on the front of the teeth and it kind of starts to eat through that enamel surface. But fluorosis, where we see a lot of these white areas, almost like chalky white markings on the enamel, have come from fluoride, and an increased fluoride intake. And even for I have 6-year-old twins, I find my son sometimes will want to swallow the toothpaste, and I'm like, hey, son, don't do that. And so, trying to get, paying more attention to my own kids and looking at those things. We know that we have to be really careful with the intake, and then having the conversations with our young adults, with our parents, you know, and making sure that they understand where this is coming from or where it could come from. And we see this, you know, there could be lots of different results from this, whether it's brown, could be pitted, and can cause really brittle enamel. We want to make sure that we're looking at that. And it has decreased in the US, really from 1986, 87, all the way 2002, and up to 2004. And so I think that really has helped really in regards to the education that we're now providing with the foods that we're eating, beverages, toothpaste, so much awareness now is out there. But let's talk about some of the challenges that we have, and feeling like so many practices don't even know what can we offer patients. I have so many patients that come into my practice for whitening, and it is something that, you know, we see a lot of. Is the reason they're coming in for whitening is because they have these white spot lesions on their front teeth, and they're embarrassed from it, you know, and they were told, well, we can whiten and maybe the rest of the tooth will get as white as these white spots. And yes, that's true. But there's alternative measures. There's other things that we can do to help get rid of that. And when we think about, you know, fluoride therapy, fillings, there's a lot of challenges. And this product really came out several years ago, but even to this day, not a lot of people know about it. And so I really wanted to take the opportunity tonight to really talk about it when we're thinking about, you know, biofilm, disruption of biofilm, thinking about fluoride, and then also fluorosis. This is an amazing way for us to help patients, not only looking at those white spot lesions, but also any type of area interproximally where we may see some of these areas starting. They call it, really, you may have seen the ads, no drill. But I will tell you that Icon has been out for a while now, and I basically have utilized this product on a little over 100 patients, if not more. And I wanted to just kind of make you aware of it. The beauty now from when we first started utilizing it, is that it is recognized by the ADA. So we need to really look at that and think about that. And also there is a insurance code for this, which is so great, because for so many years when we first started utilizing it, we didn't have that luxury, and now we do. There's two different types. The proximal treatment basically affects the area where, you know, there could be some interproximal decay just starting, or maybe we're starting to see it go through the enamel. And instead of doing that, you know, watch, wait, and see, and we know watching it, and let's be honest with each other, it's not going to go away, right? You can watch things till the cows come home, but it's going to continue to grow. And I can tell you that if we really educate our patients in the fact that, hey, listen, now we didn't have these types of products out there. We do now. We can actually get it while it's small. This is so effective on interproximal areas. And the way that we utilize the Icon is basically we would place a little wedge so we can wedge it apart. Patients do not have to be anesthetized. And I will tell you that this is a 15-minute procedure. So many hygienists, you know, that I have just became amazing friends with, share with us some of their frustrations. But let's talk about doctors here, for any dentists that are on this line, is, you know, when we don't have patients, and I hear this constantly, especially with social media, you know, how can we increase our production? And what do we do when we don't have patients? And how can we, you know, keep hygiene busy and keep that hygiene chair full? Well, are you really looking at all the areas that you could really focus on? The first one I would say would be this. This is an amazing, amazing producer in itself, because of the fact that so many patients throughout the day will sit in your chair and sit in the restorative chair that have these areas that may just be starting. And one of the things that we really started incorporating is that verbiage when we start to see it in the hygiene chair, is once the doctor comes in for the exam, if there's little areas, I will tell you that our hygienist will go ahead and do this. It's totally legal for the hygienist to perform these procedures. And basically what we do is you would take a little wedge. Again, patient is not numb, right? We're not prepping anything. We're not drilling at all. We're basically taking a little wedge. We're just prying the tooth up, you know, just separating it ever so slightly. When I say prying, that's probably not the word to use. Separate the tooth just ever so slightly. And just utilizing a very comfortable wedge, not the biggest wedge we possibly can stick in there, just enough to really get a little separation. And basically what happens is the surface of the lesion is eroded with a 15% hydrogen basically gel that opens up the pores. It's basically a unfilled resin, okay? And what happens is that we will put what we call basically an etch on the tooth. And I'm going to walk you through exactly what we need to do. So the first thing we would do is, like I said, we'll put the little wedge in there. We'll place our little etch that basically is in a syringe. This is why we're using a rubber dam. You don't have to use a rubber dam as long as you've got good isolation. It's just like if you were almost doing a sealant, okay? And then what happens is that once we've done that, we're going to rinse it off. We'll apply what we call the IsoDry, basically a little alcohol. And it's just going to kind of come out. So you want to be real careful because it does taste kind of nasty. But basically, we're going to just kind of squeeze it out. And what it does is it just dries out the tooth. Again, thinking about a sealant, right? We're etching it, and then we're, want it to be really frosty. That's really what's happening. It's just basically drying it out. And then the icon is applied right into that interproximal area, into that lesion that patient has just had starting, right? That little area where it's starting to go through that enamel and starting to eat in, and we want to get it while it's small. And so the beauty of this is that it really allows that icon. It's basically a twistable syringe, so you just twist it and it'll run, you twist it and it'll run a little bit. But what it's doing is it's filling in all those areas where we etched, and then again, we rinsed it, we applied our icon dry, and then now we're going right into the icon material. This is so amazing. We could do so many areas really quickly, but this is about a 15-minute procedure. So you can imagine when you look at your production, or you look at maybe what's going on, telling the patient, listen, we can fix this in about 15 minutes. If you've got 15 more minutes, that's about how long it would take me, and we can take care of this today. A lot of times I think we just don't think about what else could we be doing, but most importantly, it is a benefit to the patient. So once we have done that, we'll make sure that everything, we'll just kind of apply that icon to the interproximal area, and then the excess material is really removed and light cured, and now we're ready to go. We want to make sure that, again, it is an unfilled resin, so it's definitely a curable material, super easy for our hygienists to do. And something that you can just do right there in about 15 minutes. But let me share with you what's my favorite part of this is really the smooth surface. This is where we have patients that actually cry. They get very emotional because they're dealing with fluorosis, and they pretty much have a lot of times for many, many, many years, and just felt like there was nothing out there. And with the smooth surface treatment, it's a very similar, right? We're going to use our etch. Is a 15% etch. We're going to, just apply it to the surface. And the beauty of this, which I'll show you in a minute, is it's a flat end, kind of a carpet brush syringe. We just twist it. It'll come right out through the center. And we're basically going to just open the pores of the enamel, so this way we can get a good bond. So we're going to twist it. And as we twist it, the edge is going to come out, and we're going to just kind of, I kind of scrub it just a little bit into the tooth. And I'll do that a couple of times and then rinse it really well. And then we're going to apply our icon dry, which is basically how we're going to get that enamel to really be more susceptible to the icon. Once it's applied to the facial surface, it'll penetrate straight through. And the resins really allow those white spot lesions to basically disappear. Once we do that, we're going to dry it and then light cure it. And I can tell you, we do this a lot of times 2, sometimes 3 times, just depending on how much of that fluorosis is across that enamel surface. But again, this is a great service. And I want to show you a patient. This is one of my partners here. He's a dental assistant. And so during lunchtime, basically right after lunch, there wasn't a patient in the chair. And so John said, hey, Michael, why don't you come on over here? Let's utilize this icon on you, not really knowing exactly what the outcome was going to be. And again, being a dental assistant, we were like, wait a minute, the first thing we saw was those 2 little spots on those 2 front teeth. And we were like, man, would this work? Because we really want to help Michael, he's a dental assistant, to have a better smile. And he was very conscious of those 2 areas. And so again, think about this. It was after lunch. We only had about 30 minutes and jumped right in the chair. Thinking about here, we took some photos because we wanted to be able to just have a before and after and utilized a block out. So this way we could really enhance those two white spot areas of the teeth because we really wanted to show you, what it can do. And so we're utilizing the edge here. It's so easy. You just kind of squeeze it out. You just twist it. So it's very controllable, and we just put it right over those two white spot areas, left it on there for a few minutes, and then just rinsed it off, and we did it again. But one of the things we did is added the Icon Dry. You'll see it's very frosty, again, almost like you were utilizing an edge for sealant. And now we just we applied the Icon right to it. We kind of twist it, let it run a little bit, twist it, let it run a little bit more, just to fill over that facial surface. And we were like, oh my gosh, I wish we would have taken more step-by-step of this. I don't, and can be really honest, we had no idea it was going to come out this beautiful. We were, John and I both were kicking ourselves. We were like, why? It was that one patient. Why didn't we take these images? Why didn't we do that? But you can imagine how many patients now say yes to the Icon because of Michael. I can't tell you how many patients, and these are photos that we have on our desktop so we can show patients. It is such a great service, and I would not be so enthusiastic about it if I, again, didn't believe in it, but just seeing these results, this is an amazing before and after. And again, could just kick ourselves for we didn't take full-blown step-by-step, but we do have a nice before and after, and encourage you to do that because patients want to see other people. So you're able to really and truly be able to showcase, what it can do. And again, I'm always looking at what else can we do in our chair that is a service. We're not selling dentistry. We're looking at what else can we do to make that patient feel, have more confidence, but most importantly, feel great about themselves. So just, again, something that I wanted you to understand. This is not a good candidate here, okay? So Erica, one of my other assistants, isn't. So one of the things that you want to, think about is, if you have these areas that were in the tooth, and it's something that you want to talk to patients about, because there are times where, they're not a good candidate for the Icon, because if that tooth was forming, maybe they had an accident like Erica did. She actually fell and bumped that front tooth, and as it was forming and coming in, she had an internal white, two white lesions here, and she actually has one on the lower anterior as well. It was really something to think about. And I can tell you with Michael's case, and one of the questions was, was that developmental? No, it wasn't. Now, Erica's is. Michael's really developed because he had braces, as a young adult, and really and truly didn't take good care of those two areas on his front teeth. But ironically, it was just on those two front teeth, which is kind of weird, right? You would think there'd be on more. Maybe he started taking better care of it as he went on down the road. But with Erica, hers is developmental. And so that is not a good case, and we tried. I would be lying to you if I told you that we didn't try. But those are patients that you don't want to, and sometimes we don't know, or we may not know enough, or the patient may not give us enough information, so we would have tried, and at least, we would have exhausted our means. But again, it's a great service. You have to check into it more. And if there's any questions that I can answer for you, or if you want to reach out to me once we're done today, I'd be more than happy to share with you some other cases. Again, I'm always looking for what else can be done in the hygiene chair, in the assistant chair, to increase production, because we are in a business. But most importantly, again, having that service is so amazing for patients. Now, let's get back to the reason why, you really attended the course tonight, is when we understand the biofilm. We talked about that, but most importantly, what does that have to do with polishing? And I will say that there was a really amazing article, and if any of you get a chance to look at it, Denise Heater had written an article back, I think it was like in 2015, maybe it's 14, and it had wrote it for Dental Product Shopper because she was teaching more and more coronial polishing. And I will tell you that was what, I'm teaching more and more myself and putting together learns for assistants, that she really opened my eyes to just being brutally honest about, this, and having to go back and read more hygiene journals, and that's what we do as educators. We're having to go back and read, right? We don't know everything, but want to go back and make sure that whatever we're putting together or what we're teaching is correct. And so she talks about, how Dr. Esther Wilkins basically had written had definitely written several articles, and one of the ones that really she reflected on, which is the reason why I went and read it, was the extrinsic stain removal, and talked many years ago on some of the selective polishing, but most importantly really looking at how patients really feel, for us to go through, patients who are so used to us doing polishing every single tooth, and not doing the selective polishing. They don't quite understand, why are we doing that now? It used to be the coarser the prophy paste, we want to get in there and get the stain off. We want to have them run their tongue across it and make sure that they feel like, wow, this was a really good cleaning, even though that the cleaning was involving hand instruments and scaling off the calculus and all of that. And it's amazing. You could get in there with a sandblaster and get rid of all the calculus. But if they rub their tongue across their teeth and they feel the least little bit, right, it's like, oh my gosh, you didn't do a good job. And so, educating those patients now that, we know that the course of this prophy paste is, and even using brushes like we used to with stain, can really cause, some significant issues to enamel. And so again, patients don't understand that. There's still practices that'll still go ahead and polish every tooth just because they don't want patients to feel like they were shortchanged, but again, thinking about that selective polishing, more and more practices are doing it because we're trying to really conserve that tooth structure and making sure that we're not encroaching on that tooth, surface. So want to really think about that and talk about this area. We know that biofilm, again, I'm not going to preach to the choir when it comes to the biofilm, but it's really important for us to understand, why are we doing what we're doing? And sometimes we feel kind of, crazy having to explain this to patients, but again, it's all in their perception, whether or not they feel that, we're doing a good service. And so, when we think about the biofilming, why is it important? We're really looking at those habits, again, going back to, brushing, flossing, and all those other areas, but we really have to make sure that they understand why we're doing what we're doing. Research has shown that polishing really can lead to enamel mineral loss. And that is something that I hear myself on a regular basis trying to explain to patients, but now I even hear pretty much our team, everyone on our team saying the same thing. And that's something that you want to all be on the same page with. And the other thing is, if you have more than one hygienist in your practice, you don't want one hygienist that polishes every tooth and then you have another one that's doing selective polishing. So, and that's happened in my practice where we have 6 hygienists, and 2 of them feel like, I don't want patients to not be mad at me because of the fact that we're not polishing every tooth. So it has to be a unanimous decision for everyone to be on the same page, because you don't want, one patient to say something about one hygienist versus another, or one team member. So, but I think just having the patient to understand, and even we sent this out in an email blast to our patients, and I'd be more than happy to share that with you so you can do the same, is, having the research and sharing with them that now we know that, before we were using the same thing as using a really hard toothbrush, right? Research has shown that it can lead to enamel loss, and this is why we're limited and really want to, not go with the really heavy, coarse materials, but most importantly, do that selective rubber cut polishing. It is necessary, though, when we think about the removal of biofilm, but we also don't want to make any changes in the tooth structure. And so we know that that determination really has to be made in the comprehensive exam and when that's completed. So, we wanted patients to understand that, so we weren't, having them go back and complain about us, right? Because that will happen too. So understanding that and having them to understand that, our patients deal with biofilm throughout their whole life. And I think that's something that we also want to make sure. And again, getting back to that selective polishing, controlling the biofilm, thinking about that systemic disease progression. And so the benefits of doing the polishing really is important to think about, all those other areas that, again, we keep harping on, but I want to make sure that you understand that is also making sure that this is so effective with all that superficial biofilm and plaque that's really sticking to the teeth. And when we think about stains, we really want to look at, the polishing paste that we're using, and thinking about what is going to come off. And this is another thing that we put together as a nice form, really for us to help educate each other, but most importantly, our whole team is on board with what type of stain is going to be able to be removed, and helping our team to understand, what is extrinsic stain and also intrinsic stain. Extrinsic is on top of the tooth and it can be removed with polishing, but we want patients to understand, brown, yellow caused by smoking. And again, this was something that we put in an email blast because the service that we utilize, we can do that. And so it really helps us to not have to, have the talk with patients as much, because we're able to really educate them prior to their cleaning appointment. And this is something that goes out prior to the cleaning. So when they come in, they would have already seen it, and hopefully they would have opened it up and read it. But if not, we actually educate patients right there at the chair and have these at our desktop. And then the intrinsic is really in the tooth. It can't be removed. And so this is where, we think about our tetracycline, blood disorders, fluoride. There's a lot of areas that things could be caused. And so we think about that as our green stain. And one of the things we want to really mention is, we really take it very personal when we want to utilize amazing, prophy paste, but most importantly, what are we using that is, kind to that dentition, making sure that we're not using something that's really harsh, but most importantly, utilizing a product that, is going to help us to remove the stains, but give us choices, whether it's fine, medium, coarse, and even extra coarse. But I will tell you that, this is something that we really take pride in, is that we're able to do that. And I will tell you that even before I do whitening for patients, I will sometimes do a selective proofing or rubber cup polishing, just to make sure that we have really good results. And I want to back up just one more minute here. You can see on the slide that we have a lot of dark areas. And so one of the things that we will contribute that to is just having, something that is splatter free, but most importantly, being able to have a product that will help us remove those stains, because we don't want to spend, again, a whole lot of time, but we want something that's going to be effective and work. And again, utilizing this colors line from DMG has allowed us to really do that. I want to just mention one other thing, that, it's so important for us to give you the information and everything that you need and to be successful. There was a study done by Spear many years ago that, really shows that patients, there's about 400 patients that were surveyed. And out of those patients that were surveyed, what was amazing about that is that when they would turn down services, it really did not have to do with money. There was only about 18% that said that financials were the reason why they didn't move forward with treatment. The main reason was because they either did not establish a relationship with the person that was relaying that information, or the clinician, but the highest percentage came because they didn't understand why they needed it. They did not get it. It didn't register. And I know in dentistry, we all say that. We all feel like, when we're explaining things to patients, we're like, well, I explained it to them and I know they got it. I gave my best spiel. But again, everybody is very different in the way that they, that they learn, or from what they understand. And believe it or not, we're finding that more and more patients, and that's not me, that's science, is that when we have videos or we have photos, but most importantly, photos along with videos, they get it. And so one of the things that I am such a big advocate for is utilizing videos on our desktop, having those where if it's out of sight, it's going to be out of mind. But if you have these tools that you can pull and place on your desktop in your op, so this way when we're having conversations, say, you know what, Nancy, let me show you this. Let me show you this patient. Let me show you what we did. And I know that a lot of times you might not have those before and afters or cases like this, but that's where we come in. We want to help you be successful in regards to understanding rubber cup polishing and why are we doing selective polishing with great big photos and giving you, a PowerPoint. You don't even have to know PowerPoint, but having these befores and afters of utilizing icon, smooth surface, and a proximal surface, talking about fluoride and why are we using a varnish, or maybe we decide that we want them to use a foam, and why are we using a foam? Well, again, things register, looking at the types of stain and most importantly, being able to have something where we can pull up and patients will understand. It's amazing how many patients, after they saw videos, understood and moved forward with treatment. And so that's what I want you to really think about. We want to be a resource for you for that. And you can go you can email me at Shannon@chairsideassisting.com, Shannon@chairsideassisting.com. You can also go to our website. It's called ACA Campus, acacampus.com. And I want to help you get all of these, all this information. ICON is such a great service, and I can share with you what do we charge and how you can file that for insurance, because insurance does cover it. It is accepted now by the ADA, which is amazing. Think about all these things that you can do in your chair now to really increase production, but most importantly, you know, again, a lot of practices where they're having hygienists clock out because they just don't have the patients. This is the easiest thing for us to do, is to move patients from one chair to another, or go ahead at that same time and educate patients, and most importantly, move on with treatment like this, utilizing that ICON. And so again, so many things that we can help you with. And one of the things that I wanted to do tonight was not talk so much, but be able to answer some of the questions that you may have, and really looking at that and just trying to see what we can answer for you. First question was, do all caries have a definitive resistance to an Explorer? And I would say no. Not all caries do. You know, sometimes we'll think that, you know, if the Explorer goes in it, that's a sure sign that it's a cavity. But a lot of times that can happen once it's almost too late, right? One of the things that I encourage you is to really look at these areas. And I think that that is such a great question, because of the fact that I have worked for doctors, and I have hygiene friends that work in practices where they will see something on an x-ray, and again, we're not able to diagnose, but talk to the patient about you know, these dark areas and what could be happening, when we really know that that's decay starting in the interproximal area, and having a doctor come in and say, well, we'll just put a watch on that. We'll just watch it. And the thing is that I really want to encourage you doctors that when you've got team members that bring up treatment or are really co-diagnosing, we're not allowed to do, you know, not allowed to diagnose, we don't want to step on any toes here, but, you know, if you shoot your hygienist down after they have spent this time, and remember, they've spent the most time with patients, really, you know, they're the ones that the patient trusts. And if they bring something up and then you walk in the room and you say, we're going to watch it, I will tell you that you cannot get upset with your hygienist for bringing up, not wanting to bring up any more treatment, because it makes us look bad, you know, when we're really trying to educate patients, and then you come in and you say, we'll watch it, we'll watch it, we'll watch it. You know, this is the time to really have a different look, you know, to really look at things very different. And if we're really trying to encourage your dental team members to help you co-diagnose, to bring up treatment, to talk more to patients about the things that are happening in their own mouths, you also have to respect them and to give them that chance to be able to have those conversations and to back them up. You know, and this one particular doctor, I love him to death. And I wish I could tell you his name, but it wouldn't really do any good. But I told him, I said, you know, come tomorrow, you just have to say, I agree, I agree, I agree, I agree. Because she said to me, you know, Shannon, why would I continue to talk about treatment if he always said we could watch it? Or, you know, it makes me look bad. It makes me look like I'm trying to sell patients or sell them something they don't need. And I don't want to do that, because I do care about my patients. And so just think about that. And thank you so much for that question. For the fluoride gel, is that a nut-free tube? Yes, it is. And that is really, this is like one of the only ones. When you think about the colors line, that's probably one of their biggest claims to fame, is that, because so many patients right now, you know, people are gluten-free. They want all of their product line is gluten-free, which is something that we don't see a lot of. Aspartame, saccharin, casein-free, non-sweeteners, doesn't have, you know, it has sucralose and also xylitol, which is a huge, huge plus. But most importantly, it is, you know, it doesn't have any of that. Those areas where, you know, we think about being nut-free, absolutely. And I love the fact, again, the buy one, get one free. That's a huge plus. You know, all of us have a budget. So I think that that's something that we really want to think about. Is it better to brush immediately after taking food or not? I'm not really sure what that is or what that means. Jennifer had a question, was Michael's case developmental? No, it was not. And again, going back to him and Erica, you saw a significant difference. Michael's was basically on those 2 front teeth, was not developmental, because if it was, it would be inside the tooth and not on top. And remember, we're etching that surface and we're applying our Icon Dry, which is basically an alcohol. And just so you know, people say, oh my gosh, alcohol, you're putting alcohol in the tooth. Well, just about every product that we use known to man when it comes to bonding procedures have alcohol in it. So, you just want to have that suction ready, and just keep them, make sure you keep that, because nothing in dentistry tastes good, right? Except for this color's line. So just maybe, making sure that is, that you've got a suction there, that you're able to, not have that run on the tongue. But most importantly, thinking about, is it on the surface or within the tooth? And that's one of the things you got to ask yourself. And so we've created, along with DMG, these little, sheets to be able to ask questions, so you can make sure that when you talk to the patient about doing the Icon, that they are a good candidate. Because the last thing we want to do is have them not be a candidate because we didn't ask the right questions, or we didn't really know that was going to work for them. So we'll walk you through that and help you with that. But this is such a great service. Oh my gosh. What do we typically charge? I can tell you, when we first came out with this, and that was something that we weren't sure, what in the world do we charge? And so one of the things that we wanted to make sure of is that it was a really honest fee, and that we didn't feel like we were breaking the bank. So you want to look at, what is your fee from your distributor, whether it's Shine, Patterson, whoever, but I can say that you want to look at what are you paying. But one of the things in our office is that we just decided, what would be close to a one surface filling is kind of how we judge it. Some practices charge even more depending on the surface, right? So if we think about a one surface composite, most practices charge anywhere from 80 to 130. That's, kind of on the low end. But I think that is something that, is very much realistic. In my practice, we actually charge $99. And we don't have patients, complain or have any issues with that at all. And so, I think that it's totally up to you. If we're doing more than one surface, we'll definitely lower the fee. So this way they do feel like, it was worth it, and that we're getting a really good, outcome. So definitely excited at the fact that it does have an ADA code. And I can tell you that I can give you, if you are interested, as far as having that. Now the codes have changed. So when we think about what we're using, it basically is an infiltration resin code. A lot of practices will use a D29. And that is something that, a 2.9, and basically what they'll do is they'll code it as a resin infiltrated or infiltration of incipient smooth surface. And so that's one of the things that I would encourage you to do. But I will say that this has a new, a specific code that they're using, and have proposed that. So I'm going to get that new code for you here, so this way you can have it. And like I said, I've got it all here, and we've got the case reports, utilizing it, but most importantly, giving you a lot of videos and things that you can share with your patients. Basically it'll read a D29XX, which is a resin infiltration incipient smooth surface code, and they just, like I said, had came out with that not too long ago. So I want to make sure that I give you that, and I should have had that already pulled up for you. So I'll make sure I get that over for those of you that are interested. But we also can make sure that that we have that from any of the downloads that we've got. So last but not least, access to that SPEAR study. I'd be more than happy to give that to you. That SPEAR study was very much an eye-opener. You also can just Google cracked teeth and SPEAR, but I'd be more than happy. Again, I'll put it on my website. It basically is ACA Campus, and if you go to that acacampus.com, you can go there and I will have, just a little information there about tonight, have those videos for you, and then I can definitely upload that study so this way you have it, and then make sure that you've got the right codes to file, and really what a lot of our practices are utilizing for what fees that they're utilizing, and give you some best practices, because I think that's something that will help you to determine what might be a good fee for your office if you haven't already done that. But the other thing is getting in touch with your rep from DMG will help, because the fact that they can share with you like what are other offices in your area. That was something that we did, because we wanted to be able to have a, really compete with our local practices. So this way we were able to, have something that we knew wasn't over the top compared to some of the offices in our area. So again, just being able to have that and having that conversation would be good. So just kind of think about it. And again, having the classification there for the right code. So let's see if there's anything else. Can you share the insurance code? Yes, I'm going to get that for you here in just a second. What type of patients will ICON not work on? Again, just going back to, remember, it cannot be a patient who, it has to be, I always say it has to be, you think about this plaque sitting on a tooth and starting to eat through that enamel. Those are those patients, right? So think about that. If you feel like it's developmental, then we know that's not the right patient. So, so just kind of think about that. You don't want to overpromise either, because there are and have been, and I'd be lying to you if every single time we used it, it was absolutely perfect. There are times where it looks 75% better than what it did. So, again, having something like that to be able to share with patients. But I will tell you that I have not had a single patient be upset or tell me, oh my gosh, Shannon, you know what, I can't believe, that this didn't work, or that you talked me into something. They have never, ever, ever said that. And so when we think about, utilizing this, and again, we're using the code D2990. And again, that's the resin infiltration surface lesion. And again, it's a D2990. We also will put in, but I'll make sure that you get that. We'll put that in, so this way you'll be able to look at, what are we typing in as far as our narrative goes. But that's basically the code that we would use. Jamie says, does fluoride varnish still have a higher cavity rate reduction than the foam? Jamie, I have those studies, and I can share with you, and I'll back up just a little bit here. They're pretty much about the same. And this is brand new. When we were putting this together, we wanted to make sure that we had the right numbers, but I want to back up so you can see it. And you'll also be able to go back and look at this through Viva, which is what I love. You can always go back and we'd have this. But when we look at the fluoride foam versus the gel, they're about the same, 25% rate here versus, looking at the same for 25% when it comes to the varnish. They're pretty much the same. But what I do love is having something that patients can choose from, because believe it or not, I have patients that don't like the fluoride varnish. They really want the foam or even the gel. So it's nice to have that. And when you think about what is an indication to do selective polishing, that's a great question, Yvonne. I will tell you that I'm not a hygienist, but I know that one of the things, just from reading and studying and reading a lot of articles, even with RDH magazine, they have some unbelievable information there talking about selective polishing, and they really have found that they're only polishing where there could be stained areas, or they need to remove that biofilm if they haven't able to scale it. And if there were times, and some hygienists don't even do polishing hardly at all, it's only on certain surfaces. And so there's some really good studies out there, and I'll be more than happy to put some of those articles as well together so you can download them, different perspectives of when to do selective polishing and when not. And so, really I think it's based upon what you feel and how you feel about it, and what everybody else on your team is doing. Because again, you got to be on the same page. You don't want one person doing it and you're not. I would never, would you send the fluoride gel home with a patient? We don't. I will say that we would never send it home because it comes in such a great big bottle. We've never done that. Maybe that could be a good product. Maybe the next product for DMG is to have that gel there. So again, icon for clarification is icon indicated for precarious lesions not related to fibrosis. Absolutely it is. And so I want you to know that I'll make sure you have the downloads for that on our website, acacampus.com, because when we start to see it, and we've even got pictures on x-rays to show you what it would look like and what to look for. That's really important for you to be able to see that. But definitely, once it's started, you see that little gray area on the x-ray, uh-oh, this could be some issues. So again, going back to that, and working on class 5s, and does it reduce sensitivity? You know what? No, sensitivity is something that, I don't think that would help at all with that. But that would go back to your fluoride, right? Not the icon. And then, like I said, having that information for you would be really beneficial. Is icon also beneficial for primary teeth? Absolutely, I believe it is. I mean, I will tell you that we have utilized it, and there have been several pediatric dentists who have written articles for DMG on this particular piece. So do you not feel that plans often tie our hands behind our backs? Absolutely, they do. This is something that, like I said, sometimes it's hard to get patients to accept treatment, but it's amazing once they understand, and having these videos, they will try to find a way, especially if a parent knows that a patient doesn't have to get anesthetized and have that whole scare tactic of having a drill in their mouth and hearing that, their anxiety starts at such a young age. When we hear horror stories, it always is patients who have had bad experiences. And if we can give them a great experience by using a product like this, why would you not? And our website is acacampus.com. And you'll be able to go there. I will make sure tonight, as soon as I get off the call here in just a second, you'll be able to go there and be able to access some of this information. I'll make sure that you have it. And I can't thank enough DMG, but most importantly, Viva Learning. They've been so good to me. These are the best people. And I just want to appreciate your time tonight. Thank you so much. And if there's anything else we can do for you, please reach out and let us know, and appreciate your time. We don't take it lightly that you've done that for us tonight. So hope to hear you again on another Viva Learning program. And again, have a great week, and hope you have a great day tomorrow. Check out the icon. It's really a great product.